This is a 30-year-old woman who presented wanting to look more younger and fresher. She feels like she's only 30, but she actually looks older. She certainly was not entertaining any type of surgery. So one of the things that stands out in this patient, her nasolabial fold is certainly deep. Her jawline definition is somewhat lacking, and her chin seems a little bit kind of heavy. So in this patient, we took neuromodulators and fillers and achieved some of highlighted areas to accentuate those areas. And then we utilized Ultherapy, which is our go-to energy-based skin tightening procedure to kind of give her more of an overall lifted look. And then we wanted to highlight especially the jawline definition with a thread lift. So let me talk about each one of them. So in terms of utilization of neuromodulators, now she's not one of those typical patients that has a huge hypertrophic masseters or wide jaw, but she does have some degree of that. We did inject some neuromodulators to the masseters to reduce the fullness and the width of her jaw. Then what we did was we took a filler and we injected into the nasolabial fold as well as the chin area. And we use hyaluronic acid fillers for this. Sometimes it confuses people as to what exact type of product to use. And so for her, to accentuate the chin area, I usually like either Voluma from the Jubilant family or Restylane Lift from the Restylane family. And the reason is that they are the more firmer type of product, whether it's chin or cheek area or for liquid rhinoplasties. I do like those products. For the nasolabial fold, what we want to do is we want to inject product that is not too soft, but at the same time not too firm. The next thing we did with her was we treated her entire face with Ultherapy. Ultherapy is still our go-to first level of anti-aging treatment that we do, because quite honestly, anybody can do Ultherapy if they want just overall tightness. Then what we did to accentuate that jawline definition was we did a thread lift. And in our practice, we term this flash lift. So what we do is that we take what we call barb threads. And that means that across the thread, there are tiny little barbs that integrate into the tissue to kind of lift the tissue up. And there are different types of threads. The heavier threads, we want to try to be lifting the cheek region. And then what we do is that we take kind of a medium barb threads and we want to place it a little bit more towards the front or the anterior area. And we want to utilize that for the neck as well. We're not doing this on the neck to kind of give a neck a lift. What we're trying to do is we're trying to define the jawline. Because to do that, we need to lift above as well as below the jawline definition. And that's how we achieved a more of an accentuated jawline.